like you to close your eyes and imagine with me. You're taken into a cold room and you're strapped down naked with your legs spread. You can hear talking, but you can't understand what anyone's saying. Bright lights shine in your eyes and you scream, but nobody reacts. A clamp is placed on your genitals and then a scalpel is drawn across them, removing between 1/3 to 3/4 of the tissue. This isn't something from Guantanamo Bay. This is a routine infant male circumcision. These children are not being given their basic human right to body integrity. There's a double standard that decries and outlaws, you can open your eyes, that decries and outlaws female genital mutilation, while we ignore or condone the same practice against our sons. Today, I'll be asking for your help to protect our sons from this practice. I'd like to start with a little bit of anatomy, because a lot of people in the United States have never seen an intact penis. As you can see, the foreskin is a retractable, double-layered fold of skin and mucous membrane that covers the glans penis and protects the urinary meatus, or opening, when the penis is not erect. Its functions include protecting the glans or head from contamination in infancy. Contamination and injury. In infancy, it acts as a sphincter, allowing urine to exit while preventing feces from entering the urinary tract. Throughout life, it protects the thin-skinned, sensitive glands from friction and irritation. It's actually very similar to the eyelid in its form, function, and sensitivity. It's comprised of unique zones and specialized nerves that are important to sexual sensitivity later in life. In circumcision, all of this vital organ is removed. The American Academy of Family Physicians estimates that up to 35% of circumcisions result in complications. Dr. Lynn Wu at Vanderbilt Children's Hospital Pediatric Urology Clinic says the #1 complication they see in her office is urinary meatal stenosis. It's a condition that is scar tissue at the opening of the urethra. It causes urinary discomfort and disorder. It's seen only in circumcised males, and it's believed to be caused by a combination of friction against the rough diaper surface and constant contact with urine and feces. She says they perform 2 to 3 circumcisions per day in her office, and that they see 3 to 5 cases per week of meatal stenosis. The treatment is more cutting to widen or open the urethra. Another complication is the so-called flesh-eating bacteria, or methicillin-resistant staph infections. They occur 12 times more often in circumcised boys than intact. Of course, with any incision, blood loss occurs. Hemorrhage can happen very quickly in a newborn. Their blood volume to begin with is less than that of a can of beer. It's 11.5 ounces. A loss of 1 ounce, just this much, requires a transfusion. A loss of 2.5 ounces can result in death. So what does all of this mean? Here's the visual aid, audience participation time. If you'll take your index card, fold it lengthwise, please. And then take it and make a little ring out of it. This is the size of an average adult male foreskin. This is what's been amputated. It's 15 square inches, and there are tens of thousands of nerve endings that are all gone forever. They cannot be regrown. What can we do about it? Right now, there are laws protecting our daughters. They need to be broadened to protect our sons. The outcry against female genital mutilation needs to recognize that male circumcision is mutilation. It's amputation of a vital organ from our sons. Contact your lawmakers. Ask them to defend the basic human rights of body integrity for all children, male or female. Ask them to outlaw all genital mutilation. When you become a parent, respect your son and protect him from harm. Thank you.
That was definitely cringeworthy.